Good afternoon, everyone. Welcome to today's presentation in our Collegiate Recovery webinar series. My name is Olivia Pennelle and I'll be your host today. We're joined by a panel, Jonathan Lofgren from Minneapolis College, Susie Mullens from West Virginia, Jennifer Cervi from the University of Virginia, and Ahmed Hosni of Ohio State University. The topic of today's presentation is Collegiate Recovery and COVID, Virtual Programming and Navigating School Reopenings. These webinars are hosted by the Association of Recovery in Higher Education in order to support the growth and development of the collegiate recovery field. Just a few reminders and logistics before we turn things over to the panel. Today's webinar will be recorded and uploaded to YouTube and our website. You'll be able to go back and access all the information at that time. If you have any questions for our presenters, please put them in the QA box at the bottom of the window. There will be a time at the end of the webinar, so we'll get to, for Q&A, so we'll get to as many questions as we can. Supplemental materials will be provided by presenters if applicable, and we'll mail them out. If you're having any difficulties or have a logistical question, message us through the chat box and direct that to the panelists if you can. We're always looking for ways to improve, topics to cover, and any other feedback from our attendees, so please feel free to reach out to us at any time and let us know about your experience today. So I'm going to turn things over to the panel. Why don't we start by everyone introducing themselves a little bit? I know that you've been doing that in the chat box. Let's go and give our names, pronouns, and roles within your respective institutions. Ahmed, do you want to go first?
Liv, I'd love to. Hi, everybody. My name is Ahmed Hosni, and I use the pronouns he, him, his. And I am a person in long-term recovery, which means that I have not found it necessary to drink or use drugs since August of 2007. And so I'm extremely grateful for the opportunities that's provided me to continue my education and to get to be present in the lives of my loved ones. And professionally, I am the assistant director for the student wellness and assistant director at the Student Wellness Center for Ohio State University. And I also get to be the director of recovery for the Higher Education Center for Alcohol, Drug Misuse Prevention and Recovery, which is an academic center here at Ohio State, and past board member for ARHE as well.
Thank you. Susie?
Hi, everyone. I'm Susie Mullens, and I'm the program coordinator for the West Virginia Collegiate Recovery Network. And I work with 7 schools in West Virginia that are funded through the State Opioid Response Grant. And we collaborate closely with West Virginia University's Collegiate Recovery Program. I'm also a previous ARHE board member and ARHE employee, and I'm really glad to be here today. Thank you.
Thanks, Susie. Jen?
Hi, I'm Jen Cervi. I am the person in long-term recovery, she, her pronouns. I am the recovery support specialist at the University of Virginia, and I also sit on the advisory board for ARHE.
Thank you. And Jonathan?
Hi, I'm Jonathan Lofgren, he, him pronouns. Minneapolis College is a community and technical college, Minneapolis, Minnesota. I'm the coordinator for the Collegiate Recovery Program here. I'm also privileged to be the founder of the program. We're going into our 4th year of operations this year, of course, in the midst of the pandemic. But as many of you know, community colleges are sort of an emerging part of our broad discipline in recovery and higher education. And so we're really excited to be one of the sort of pioneering schools as part of collegiate recovery and community colleges. And I'm also a person in long-term recovery and super excited to be here with you all today. Thanks for having me.
Thanks, Jonathan. So let's get started with some questions. It's obviously been a challenging transition back to school. What has the past month looked like in all of your roles? Jen, do you want to start?
Sure. The past month, I think the challenging part of it was that leading up to September, like August 30th, we didn't know what it was going to look like. You know, it was every day up to it. We didn't know if they were going to pull the plug on the last minute and we would be totally virtual, or we were going to be in person. So we had plan A and we had a plan B. You know, the last month we have tried to meet the needs of everybody. So we have had meetings, are what we call who's in recovery meetings. We've had it sometimes, every first and third week we are in person, and every second and fourth week we meet online. And what I have found is that students are really, really burned out on Zoom, because, you know, they say that UVA is in person, but really about 90% of the classes are on Zoom right now. And so I'm seeing that my students are really welcoming the opportunity to meet on campus, you know. And so what we're doing is we're doing box lunches, and actually we're meeting tonight. And so we meet tonight and we'll sit 6 feet apart. I will predominantly serve the meals, and we meet outside. And everybody wears masks except when eating, you know, and we do our regular meeting. And I found that we have a much higher attendance. You know, recruiting has been extremely difficult because we didn't have the typical fall activities. We didn't have the student org fairs and a lot of those things. But luckily our website, like, students have, you know, have continued to find us. And so that's been a really cool thing. You know, I think the challenge has been that, like, because our students are living in our residence halls, we have had outbreaks. And so as there's been outbreaks in different residence halls, and like the restrictions continue to develop. And so, like, now we'll say that the university will state that we can't have gatherings over 5 people. And so, like, I went to the vice president of student affairs last week and said, look, this is why recovery is so important on our campus, that we continue to meet in person, and why the connection is so important. And they're letting us do it, you know, knowing that we'll have over 5 people tonight. And so that's what it's really looked like. The other thing that's really been amazing is that VCU hosts a Recovery Scholar seminar class, and it's open to students that are grantee schools. So there's 8 schools that are grantee schools within this Virginia grant system. And so I teach a seminar class, one of them, or help co-facilitate, as well as Tom Banner, just kind of the ringleader of it all. And so we each have a section that we kind of help co-facilitate. And so students from each of the grantee schools can sign up and take these classes. So it allows students that are maybe at universities that don't have as strong of a collegiate recovery program to link in and start connecting with other students. And so it doesn't matter if you're at a school that has like stronger restrictions, you can plug in and connect. And these students, because it's a non-for-credit class, like, my students get $500 a semester for taking these classes. And so that's what it really looked like. Now that our in-person has been kind of successful, I think we're going to open it up and start having more social events on campus as well. And so it's really been a transition week by week thing on what the landscape of the university looks like. So we're really grateful to have these opportunities, and, you know, and to make it look as much like normal as possible.
Thanks, Jen. Susie?
Sure. So, you know, the 8 schools that are either funded through our project or collaborate with us, each campus has a different situation, and we have a couple of community and technical colleges. West Virginia has a free community and technical college program. So that I think gives community and technical college students a leg up. There's some benefits with that, with the free tuition. So each campus is very different. You know, some of the campuses opened back up and then had to close back down for a few weeks. It's very dependent on the local situation with COVID. But the biggest thing is we have gotten involved outside of on campus and outside of campus in the community to partner and engage with as many people as possible. So For example, Marshall University hosted a virtual Day of Hope on August 31st for International Overdose Awareness Day, and we had over 185 people registered and 25 presenters. So, doing kind of maybe non-traditional collegiate recovery activities, but having the collegiate recovery programs host and sponsor those to engage outward into the broader communities to raise awareness about collegiate recovery. We had one of our campuses participate in a regional event, which was Free Naloxone Day, and a very small campus, Bridge Valley in Montgomery, West Virginia. And we had 58 people come to pick up naloxone that day. We were able to engage with the campus police and replenish their supply of naloxone. So, those are just tremendous opportunities. And then last week we had an event with the School of Osteopathic Medicine where we highlighted all of the professional monitoring programs and a few people that participated in those. So the medical professionals, the pharmacists, the nurses, and again, worked on stigma. All of the schools shared that information out within their med school population and schools of pharmacy and nursing. And we had 80 people participate in that. So doing as much anti-stigma work and promotion of recovery in general, and then layering on top of that collegiate recovery. And then we continue to have our virtual naloxone trainings twice a week. And so far, we started that in April with Bluefield State College really leading the charge on that. And since April, over 200 people have been trained, and approximately 71 naloxone kits have been mailed to people in 3 counties. So we're really, trying to focus on engaging with people we can engage with, revisiting and re-engaging with departments on campus that can be key partners. One of our peer specialists trained residents life staff at Marshall in ally training. So, anything and everything that anyone will listen to, participate in, and give us a shot with. So we're just, I think flexibility is the key.
Thank you. Jonathan?
Thank you. I sure could echo several of the comments both presenters, Jen and Susie, have already made. The biggest challenges, I think, go along with, communication and engaging folks, recruiting new members. For instance, we had to skip our annual Recovery Month event. We have a big Recovery Month event that we've been doing for over a decade. That, over the last few years, of course, our CRP has been central in, but we couldn't have it. And it is like a big Recovery Month fair. And so we'd have 50 vendors from the community, and 1,000 students would come through every year, and we'd have a bunch of community folks come in. But we couldn't do that. And the outcome for our collegiate recovery program, the first 3 years after this event that kicks off at the beginning of our school year, is we'd have 25 new collegiate recovery members, people coming into the CRP. Well, we didn't have that this year. And so we didn't have a host of new CRP interest as a result of the event like that. And I know that's been something that lots of folks have had to sort of sacrifice some of those community gatherings for Recovery Month. So that was a big sacrifice. I got some feedback from some of the members of our collegiate recovery program for this event here, talked to them about being on this panel and what their thoughts were. And lots of them said, the communication, not having the social connection has a big impact on students in recovery's personal lives. And so I think them feeling disconnected physically is taking a toll. As mentioned, Zoom fatigue is also huge. Last year, our collegiate recovery program was really bustling at the seams when the pandemic hit, and then we had to shut it down. And so, and all of our education and our support services for students went virtual in the matter of the spring break week. You know, we had a week off and nobody came back and everything was vacated. So that's been a big challenge. And of course, trying to figure out what to do over the summer was very challenging. And so when we talk about some of the victories, of course, some of the innovations that emerged from this, from our student-centered program, I think will hopefully everybody will find really exciting. I think we had a double pandemic hit here in Minneapolis, particularly with the Black Lives Movement and the murder of George Floyd, or the killing of George Floyd, really being the epicenter of, you know, sort of the racial unrest going on in our country is also taken a big toll, I think, on our CRP, our student participants as well, in terms of, you know, focus, stress, and anxiety, and those types of things, sort of, you know, being compounded in many ways by both of these things sort of happening simultaneously. And I think those are some of the main challenges, like the big challenges of going into this time. Coming back together and kicking off this year has also been a big challenge in terms of now everything's on this sort of virtual platforms, and we're less than 20% of hybrid model courses in the school. So very little student, you know, physical engagement with the campus. And I've really been trying to promote using the language of physical distance and social connection, because the social distancing, you know, language, I think is sort of counterintuitive for recovery, at least in lots of people's lives. You know, some people go about recovery on their own, but so many people were trying to, you know, reinforce the philosophy or approach of working with other people in recovery, and having the language sort of being repeated so frequently and often, just social distance, social distance, social distance. I think that's been a big challenge. So we're trying to change that narrative a little bit by reiterating physical distance and social connection as a way to sort of overcome another one of these challenges to coming back together in the environment that we're sort of all living in. And we also did, I think, got permission to have our Collegiate Recovery Drop-In Center open for personal contact 1 day a week. And so whenever, every Wednesday, we'll have 10 or 20 students come in here to campus and get into our drop-in center, and, you know, taking off masks too quickly and hugging each other and stuff. And so trying to abide by physical distancing is also a challenge when I think, you know, our students are so hungry to be connected. And so it takes a lot of intentional discipline to maintain a few of those social boundaries or physical boundaries and still be socially connected in the environment. But again, with one of the wins, having that Collegiate Recovery Drop-In Center open seems like it's really been a real lifesaver, godsend for the students that are so hungry, students in recovery that are so hungry to be connected to each other.
Thank you, Jonathan. Ahmed?
Yeah, hey, yeah, it's hard. I don't know what's left to share. I think I could, like Jonathan said, you know, just kind of co-sign a lot of what has already been said. I love the physical distance, social connection. I've heard of physical distancing, but the social connection piece is so important, and I like the way you phrased that, Jonathan. At Ohio State, you know, like we quickly transitioned in March when you know, everything seemed to be happening so fast. We were able to get up and running and providing virtual services quickly, and we're lucky to be able to say that we've had continued engagement from our students throughout that time, which I know how lucky we are to be able to say that, because I know lots of programs have you know, struggled to stay in contact with their students. And so one of the things that we've now been able to do throughout that time and then into the last month is be there when our students struggle, because they've been struggling. And I think that it's, you know, such a difficult time right now. So to answer the question very specifically, on campus, what's looked different is we're trying to do things in a hybrid model because our students are not responding to being online very well anymore. And they definitely weren't throughout the summer. And so what we did was make it so our CRC meetings are hybrid. And so we have a space on campus where students can elect to meet. And then there's like a projector, big screen, where the Zoom is like on the screen. And so they can see the people who are zooming in, and we have a wide angle camera that is capturing the room. And so it's kind of got that, you know, you can be virtual or in person at the same time kind of feeling. And that was what we were hoping to do. And you know, I think it's great. We're glad to be able to offer that. But we also see that, like, for our students, a lot of them are still pretty concerned about contracting COVID. And you know, while they don't want to be virtual, they also don't want to be in a room with people who they're not sure whether or not they've been physically distant or not, you know. And so it's hard to really find, like, so like it's this, so we're kind of stuck in this place where you feel like you're not doing enough, right? As staff, I'm like, man, are we doing enough? Are we doing enough? But we're working 3 times as hard to try to meet everybody's needs. And so then it's this feeling of like, almost this feeling of being hungry but never being able to be full, right? Like this drive and desire to want to support our students as much as possible, but never being able to feel like we're doing enough because they're not thriving. And it's not their fault that they're not thriving. It's not that there's something that they're doing that if they'd stop, they would be thriving. They're not thriving because we are, as a country, going through, as a world, right? As a planet, we are going through this traumatic experience together. And I would say it's amplified in our country by things like racial tension, by not very great response to this pandemic, and it being exponentially worse here. But yeah, and so what we're trying to do different, it feels like you're working 3 times as much and getting a third of the success or the outcomes that you hope to get. But then you're also being pulled in other directions, because like we're on campus and we have students, much like Jen, we have students living on campus. And so it's all hands on deck to be able to create safety protocols and support all Ohio State students. Like we're being asked to not just support CRC students, but all Ohio State students in creating a safe and healthy campus environment. And so if there are times when it feels like you're being pulled in 1,000 different directions, and it's I'm really grateful that we've been able to stay connected to our students, but it's sometimes hard to see them struggle as hard as they have been. And so trying to support them, and then also trying to support one another, and making sure that I am staying connected to my colleague here on campus. I'm lucky enough to not be the only person in my collegiate recovery program. Like I have a colleague that works to support our students as well. I know I'm one of the lucky people who's able to say that, but also trying to stay connected to other people who are kind of, you know, what is the impact of watching students struggle as a staff person and not having anyone that you can talk to about it on your campus. And so how are we creating spaces where we as staff can support one another as we continue to support students who are not thriving? And like, you know, I don't know, it's been nuts, man. It's been nuts. This semester has been nuts. You know, recovery month happening in September. I remember early on people saying we are not celebrating it now, we're going to celebrate it later, and I get that, because it felt like it's felt like a lot to try to celebrate recovery month at a time when here in Ohio overdose deaths are up like 80%, and we were already one of the worst states in the country for opiate overdoses, you know. And it's like we're being decimated, you know. We're watching people, and there's a mental health crisis in our country which is being caused by the pandemic. And so, you know, just doing the best job we can, best job we can to be agile. I think that is what we are hoping to be, is to be agile enough to respond to students' needs quickly and to help address those needs quickly and to be able to respond in ways that we maybe typically wouldn't do, but we have to now because there's no other resource for them. And so I think that that's one of the things that is lost when administrators hear about collegiate recovery programs, and the impact that we have is that we respond to our students' needs in ways that most higher educational professionals don't, right? And it's such a unique job because you play case manager, you play coach, you play program develop, like somebody who develops programming and hosting events and things of that nature, and you wear all these hats. And when somebody's calls you and they're in crisis, you have to be able to respond. And so just trying to make sure that we're ready to respond in situations. And I don't know, but I think for me the most important thing is that I still there's no better job in the world. I still wouldn't rather be doing anything other than supporting college students in recovery. Like, still the greatest job in the world. And so I don't know, it's been a hell of a month and a half, that's for sure.
Thank you. What have been some of your biggest wins? Anyone feel free to chime in.
I can go first this time. On the wins too, students feel like, having a place to connect has been just getting permission from our campus. Our campus normally has like 40 student life organizations, clubs, and programs, various types of programs. And the Collegiate Recovery Program is like one of the only ones that's having actual meetings and so forth. And we did so over the summer when the pandemic hit and everybody shut down. The CRP students, in most ways, came up with several innovations to keep their communication and recovery support for each other going. So our student leadership team was coming back to us, like staff and coordinators, and saying, here's what we should do, here's what we should do. And they got it done. They got peer coaching going virtually, they had outreach going, and they had meetings going. They had virtual drop-in times, and this stuff was scheduled and marketed over the summer when there was virtually no other student life organizations communication. The student life directors communicating, there's still a student life program, but the different organizations, really in lots of ways, the CRP team and our addiction counseling club kind of joined forces and set the tone for how student organizations and clubs could operate in this environment. And so we just continued that as the fall came, their momentum, and tried to formalize it and give it even a little more communication structure. While on one hand, communication and marketing has seemingly like it's taken a big hit in this environment where we don't feel like we're getting the word out. We always feel like we're not getting the word out about the CRP as much as we want anyway, maybe partly because of the stigma and we're new and all these different things. But that's on one hand feels like a challenge, but on the other hand, we're like the only club doing it. So we're still looking at like we're a leader in this area. And having students get together and try and stay safe and just giving each other support, that's been another big win. The third win I'll say is we got a renewal for one of those grants with having a recovery navigator from Recovery Corps, AmeriCorps programs. It's a national program, and so last year we got a grant to have one, and then it took about half of the academic year to get the person identified and placed and everything. Well, this year the person continued their mission, so we have the same navigator for a whole year this year, and she's already on board. And so having somebody doing outreach and recovery support kind of from another angle where maybe a little more case management insights and knowledge and resources are also part of her role, I think is something else I think that's been a big win is continuing this collaboration with AmeriCorps Recovery Corps in the midst of this pandemic. I think that's been a big win. The last area maybe would be the campus acknowledgement of the impact that the Collegiate Recovery Program is having. I think Ahmed kind of alluded to the awareness of our institution on the kind of impact that we're having on campus life and students' lives. Even here in a community and technical college, it's been an overwhelming amount of support and recognition that the students that are involved in the Collegiate Recovery Program, they have a different level of support unlike any other students from different programs on our campus. And I think that has been highlighted amongst the administration in different areas of the campus. And those are some of the wins. And on a personal level, seeing the student leadership in recovery, those students that have taken a leadership to sustain the CRP and make sure it's happening, it's just been phenomenal. And to me, it reminds me of the talent that sometimes is under or overscored or overlooked because of substance use disorder, but the phenomenal depth of talent in our student leaders has really sustained our program and taken it to another level in the midst of these two pandemics that are really plaguing our city and state.
Does anyone else want to share some wins?
I would say, 2020 is all about resilience and flexibility, and I say that because like sometimes we can have it in our focus that we're going to meet in person that night, and the way that we're doing it is so that we're meeting outside because my students don't want to meet inside. That doesn't let them feel safe right now. But then the weather can hit, and like one night we had a horrible storm that just ran in right at the time we were going to meet, and like we just had to be flexible that we had to do it the next week, and so I think some of my wins are just like being flexible and really rolling with the punches and meeting the accommodations of like each and every student. I do a lot of case management one-on-one with my students, and some of them and best suited that we meet on Zoom, and that's great. And then there's some that just really, because they're so tired of sitting, in front of the computer all day, that we go and we take a little socially distanced walk, and we'll go just kind of walk around some of the buildings on campus and then come back. And so I think it's really like, one of the downfalls is that I don't get eyes on as much as I normally do. I don't have students popping in on a regular basis, and I don't see the mental fatigue that's going on a regular basis. I only see them like once a week or for case management. And so I think that the biggest wins I can get is the more touches, the more emails I can say, hey, just checking on, or the more text messages that I can send out, or the more phone calls I can just get. When I can just have that open dialogue kind of going on. I think the other big win was really getting this approved, that regardless of what restrictions are being put on the campus, that we can continue meeting, because it's gonna go up and down. The COVID case numbers are gonna go up and down anytime you have the residence halls open. But I need the accessibility of our student meetings to continue. And so I think that was a big win. The other big win is, so our grants here in Virginia, they're over a 2-year spectrum where we got $50,000. However, due to some delays in processing, and it was the first year, we received the money in March, and the end of the grant cycle was today. And so we really got $50,000 to spend during a pandemic. And so I think the biggest wins were like, they're building us a multi-million-dollar student health center that'll open in April. And so we really got to spend the money on outfitting this 24-hour access clubhouse for them with PlayStations and a $700 espresso machine and laptops and printers. And you know, dishes and silverware so that we can be green and everything like that. That was a big win. Hoodies and polo shirts and t-shirts and everything like that was really a huge win, without spending it frivolously, you know, and I think that was a huge win. You know, I think it's just being able to listen more than talk to the students and really just hearing what they need, because I think that this is such a time of isolation for them, such a time of isolation. You know, everything is done alone, and addiction is such a disease of isolation that the two are a firestorm right now. And so the more that we can bring them together, I think that those are the biggest wins. And finally, personally, my biggest wins, because if I don't take care of me spiritually, I don't have anything to give to them, you know. And the biggest wins, we've had this, ARHE's been sponsoring this recovery meeting on Fridays, and I don't know why everybody's not attending it, but it's like been the biggest spiritual like experience that I've had in my recovery in a really long time. And these staff chats that we have on Tuesdays, just when we come and just go, okay, this is not working and I don't know what to do. They've been the biggest wins to get through all this throughout the summer, because, you know, I can't do this by myself. I need all of you guys. So that's all I got.
Thank you. Does anyone else want to share some wins, or should I move on to another question?
Well, I'll just share. So similar to Jen, you know, our funding, we had funding, but the pandemic hit, and what we had intended to expend the funds on, we weren't able to do. And so in our case, we were approved, we just found out this week, we were approved to have a no-cost extension. So we can carry that money over, and we have to spend that before the next year funds kick in. So essentially, you know, we're stretching out the life of our funding, which is tremendous, because the majority of our funding is for our staff, the peer support specialists at the 7 schools. So that was a big win. You know, ongoing naloxone work, because like Ahmed mentioned, you know, West Virginia, similarly to Ohio, you know, practically ground zero for overdoses. And, you know, just continuing to have that dialogue, trying to get openings with administration to talk about, you know, how do we get naloxone on campus, and just getting those conversations. So one of our wins that is scheduled for next month is a meeting with the chancellor of our higher education and community and technical college system, arranged with the presidents and senior administrators from all of the colleges and universities in West Virginia. So we're going to have, you know, 1 hour meeting with them before our Collegiate Recovery Conference on October 20th. And I put the link in the chat. It's open to everybody to come to the conference. We're going to provide CEs. So, you know, that's a big win, to be able to get an audience with all of those folks to try to move collegiate recovery forward on a broader scope across the state, you know, in a state with so much need. So those were our, you know, kind of higher level type of wins. And then some other wins, you know, we have a campus that was able to be access to tabling events again, outdoor tabling. So reaching students with some of the outdoor tabling opportunities. One of our schools does kind of a drive-through pickup of self-care kits, and getting information about collegiate recovery in those self-care kits. So, you know, they have some really creative ideas about how to get information to students.
Thank you. Ahmed, did you want to share some?
I mean, I would just, you know, agree with what everybody said and also just say, like, I think that it's really important that we help, kind of what Jen and Jonathan had mentioned, that we are helping university leadership understand that we're not like cute programming for students. Like, that's not what collegiate recovery programs are. This is a necessary resource for the well-being and safety of maybe one of the highest risk populations on our campuses, right? And when students return to use, the outcomes could be deadly. And so this is like, continuing to provide CRC services isn't you know, isn't like the equivalent to a student group meeting, and like having a student, like, not to minimize what they're doing, but this is a necessary service. And so being able to have Ohio State respond to that positively and allow us to do what we need to do to support our students has felt like, it's felt huge, because there was a time when we were like, are they going to let us do this or not? And they have. And so we're excited about that.
Thank you. And just a reminder to people, attendees, you're more than welcome to use the Q&A box at the bottom to ask any questions of panelists. So the penultimate question I wanted to ask is, what are you anticipating for the semester or year ahead in terms of changes or plans, your programs that you have? Small questions.
I don't mind starting. You want to start, Susie?
I was just going to say, I think adopting Jen's motto in terms of being flexible and agile, you know, everything's got to have a plan A and a plan B and possibly a plan C, because from day to day, you know, things could change that are, you know, beyond our control based on the you know, COVID spread and outbreaks and all that sort of thing. So, you know, we're just, it's kind of the plan for the, hope for the best, plan for the worst scenario.
I'm grateful to our system. We're part of the Minnesota State College and University system. And, you know, it's not perfect, but they've been decisive about the whole school year. You know, some of our, you know, public high school system and all that, they're like going, hoping month to month and week to week, whether they're going to be open and, you know, in person, or having these different models where people can pick if they want to come to class or do it all at home. And so in lots of ways, I appreciate our system just saying we're going to be online this year for the majority of all of our academic stuff. And that, I think, even though it's not what lots of people wanted, there's a solid decision, so we can just plan on at least academically, and then supporting students that are basically going virtual all year. Of course, we're a community and technical college, so some of the technical and trades have to do some of that hybrid stuff and in person, and so that's been good. One of the things that we're doing, Ahmed mentioned, you know, deferring Recovery Month events till later on in the year. And this, the students are really excited about, is we're collecting recovery narrative stories on video. And then we're working with our fine arts department and our theater department. And they're gonna do a theater production of recovery with some professional actors. And, you know, we have a fairly significant community college theater department. And so having this collaboration is really exciting and giving students something else to look forward to. So they're collecting these recovery narratives, then somebody in the theater department is evaluating and looking at the content, and then they'll make, you know, some recovery stories come live on a theater production. And so that's something that everybody's really excited about. One of our faculty members are other leaders in our collegiate recovery program, which is kind of a leadership team among some faculty and some staff, and of course the students. Came up with the idea, collaborated with the fine arts department, who also did some of our design for our logo and different things. So we have this really nice collaborative across some of the programs on campus. But that's something, those two things, I think, having some hope, and two, I think having some future targets for students has also been something. I think that's, maybe it's a win, but it's also in the future where I think where some of the students have been feeling a little hopeless, like, you know, this is all falling apart, their education's falling apart because of the pandemic and everything. but having a few things on the horizon like this, I think has given us a lot to sort of hold on to and look forward to. And then just, figuring out those kind of flexible and creative ways to be responsive to people, and then leveraging the motivation to communicate. So that's something we want to do more effectively and across our system. And I think we're seeing the innovation of both our students and our tech support across our campus figure out ways to integrate our communication. Like on our website, we've had a couple of features where students, staff, I was featured once, over the summer and into this fall, where students and staff in recovery are featured on our main website. And so I think the future is going to be, we're going to keep ourselves out in front and center, and we're going to do things, we're going to keep planning for a prosperous future for people, students in recovery, regardless about the platform we have to operate on.
Thank you.
It's awesome. Yeah, I was gonna say I love that, man. I can't wait. I hope I get to see. I hope you guys record that theater act. That's really awesome. Yeah, like I keep thinking I'm trying to I think the most important thing, I don't know that I have something definitive to say like this will happen by the end of this year, but I think that what's most important that we do as a team for our students and really for the health and wellness of our program, right? The life of our program is to not allow, to not get into this mode where we feel like we're just waiting out this pandemic and things are going to go back to normal one day. Because I don't know that that's necessarily a given, right? And so instead to continue focusing on what are we doing now that will continue to benefit our students even after this hopefully this I can't even think of the term, but whenever some sort of antivirus comes out, right, and vaccine and or whatever it is, and society returns to normal, what are some of the things that we're learning right now? Like this idea of stopping, pausing, taking stock of the work that we're doing, the ways that we've been forced to innovate, and how we are, because of that forced innovation, we are creating new ways to serve people in a meaningful way that, had things just gone on, and this might be putting lipstick on a pig, right? I get that. But had things just gone on, they would, we would have just kept doing things the way we did things because that's how we do things, and we'll always do things this way. That's not a great way to operate any program or business. And so if you're looking for a silver lining, we're being forced to be innovative, and that's not a problem. That sometimes is a good thing. And so we had goals before all of this started. We had a strategic plan before all of this started, and it was a 4-year strategic plan, and we still want to meet those goals, and we still want to work towards them, and we still want to progress and feel like we're moving the recovery initiative forward on our campus. One of the things we do is serve students in or seeking recovery, but we also advocate to create opportunities for people in or seeking recovery to come to Ohio State. We also try to create an environment on Ohio State's campus where students who develop a substance use disorder are given a compassionate and treatment-focused, recovery-focused response, and given every opportunity to receive the benefit and support that they need to enter into and sustain their recovery on our campus without having to have this traumatic experience of being kicked out of school and hopefully making it back one day, and all these things, right? There's stigma that's still out there, and we're hoping to address that, not just on our campus, but across our state and for students in or seeking recovery in this country. And so I think for me, it's to how do we keep moving forward? Absolutely, the number one priority will always be the health, safety, and wellness of our students. And I think that we do a good job at that. That's one of the things we know, that's what we know how to do real well. But how do we continue to push ourselves to move this field forward, to move collegiate recovery? One of the things we always say is that we don't just want a recovery lounge on campus. We want to create, like, just having one room on our campus that is recovery safe and recovery friendly isn't enough. We need a recovery friendly campus. And so how do we keep moving towards that? How do we keep moving towards this idea that our students don't feel like their status as a person in or seeking recovery is something that they can't share with people, otherwise they're going to be, you know, judged or treated differently or adversely. And so none of those goals have changed. And so maybe the format of how we're doing that work has changed, but that's okay. I think that we as professionals will be better for it, you know, after all of this, man. Like, I just, you know, somebody had given me the advice actually earlier this week and was like, you know, make sure you're keeping track of all the things that you're being forced to do because of this pandemic, because this is professional development. Like the ways we've had to respond to this global crisis to continue supporting people who are in having a mental health crisis and are, you know, a lot of them are like really high risk. Like, at the end of this, we need to be able to stop and look back and be like, damn, I responded, you know, and I showed up, and look at the work that I was able to do. And we need to, so, you know, take stock of all the things that we're doing, not spraying our shoulders, patting ourselves on the back, but like also don't allow ourselves to feel like we're not doing enough, but instead we recognize all the ways that we're doing so much more than we ever expected we'd have to, while also continuing to try to push forward initiatives and to grow this idea, this concept, this theory on our campus and across our country.
Thank you. I'm conscious of the time, so for the last question, let's do a quick fire round. You've got a minute each if you want to take it. What gives you hope within your role as we close out Recovery Month and move closer to 2021?
Well, one thing that gives me hope is our connection to this network, this ARHE network, and the other campuses. And so the more often I'm able to attend and participate in these types of events, it definitely triggers hope of, you know, affirming things we're doing and then identifying new innovations, or and then making these connections with people all around the country that are so invested in you know, collegiate recovery and supporting students in recovery. The other thing that gives me hope is our commitment to equity and inclusion. That's something that I think all of ARHE is really taking a serious look at and trying to be more progressive with how we're engaging the diversity across our campuses and communities and our students, of course. And so that's a big initiative here and a big initiative with our collegiate recovery program. And hopefully, you know, that also expands to the various ways people identify and think about recovery and their different pathways into recovery, so that, you know, we shed ourselves of, you know, one sort of monolithic or, you know, micro way of looking at what students need to feel supported, because everybody's not going to find the same support in, say, an abstinence only philosophy or harm reduction only philosophy or whatever. We really need to be flexible, kind of like Jen was saying, you know, across how we're working with people, and creating space for folks that don't have, you know, just one view of things. And that's something that I think we're you know, learning how to embrace as a broad system of recovery in higher education, and definitely something we're committed to here at Minneapolis College, doing things like the naloxone and not being hard on people if they had a substance use episode, or they might still smoke you know, marijuana, but they don't take any other types of drugs anymore. We want to work with people where they're at, and I think that's something that, you know, is going to make our network even stronger. It gives me hope for our program and for our field.
Thank you.
Thanks, Jonathan. I really appreciate what you said. And, we have struggled with, our programs are pretty much all new. And I think the blessing in that is that we don't have cultures to correct in terms of, we don't have a lot of programs that are have not been inclusive and have not had these things as considerations as they've been founded. And so, this has given us the opportunity to do a lot of training and to, examine ourselves and be really intentional about the type of environments that we want to create. So, that gives me hope. And, there's also, I think, because this is the pandemic has created somewhat of a crisis in higher education, I think it gives us an opportunity, the line from the anonymous people about a constituency of consequence. I think that higher education, needs to pay attention to this population that maybe, they never considered how much asset they can be to our campuses, and really look at the recovery community as a constituency of consequence. And how can we mobilize around that and have expectations of the schools to support recovery. So that gives me hope, because it's somewhat of a business crisis when you look at enrollments going down and that sort of thing. So how can we show administration that this is the right thing to do at the right time to invest in these programs, and the return on their investment is going to be tremendous for not only the schools but the communities overall.
Thank you. Unfortunately, that's all we've got time for today. So I hope this session was useful for everybody, and that you'll share it with colleagues and stay connected with ARHE to learn about future webinars and let us know how to improve our offerings. Thank you to the panel for today and taking the time to present to our attendees. We appreciate everyone's time, and we hope to see some of you on our next webinar. Stay tuned for the details, which we'll be posting shortly on social media. Thank you and take care.
Thank you, Liv.